If you're over 60, there's a silent problem that could slowly be stealing your energy, balance, memory, and independence, and most people never realize it until something serious happens. It's not always a stroke, a heart attack, or a big dramatic event. Often, it starts with something much quieter, gradually reduced blood flow to your brain and your legs. You can't see it. You can't feel your arteries narrowing. There's no alarm bell. But over time, this slow change can affect how clearly you think, how steady you walk, and how safe you are from falls and serious complications. Quick note before we dive in. If you're a senior or you're caring for your parents, and you want simple, clear explanations like this about blood flow, brain health, heart health, and everyday senior problems, consider subscribing to Senior Guide. I make videos just like this to help you stay informed and independent as you age. In this episode of Senior Guide, I'm going to walk you through 7 early warning signs that your brain and legs may not be getting the blood flow they need. These are signs many seniors brush off as just age, but sometimes they're your body's red flags. This video is not to scare you. It's to help you notice patterns earlier, so you can talk to your doctor, make changes, and protect your future health. Getting older doesn't mean you must accept every ache, stumble, or moment of confusion as just age. Sometimes, your body is whispering that something deeper is going on, especially when it comes to blood flow to your brain and legs. By paying attention to these 7 warning signs: leg pain when walking that improves with rest, cold feet or toes tingling or numbness in hands and feet, lightheadedness or dizziness when standing, mental fog or slower thinking, trouble with balance, or a shuffling walk, slow healing wounds or color changes in the lower legs. You give yourself a chance to act before a major event. This video is for education only. It is not medical advice and cannot replace a consultation with your own doctor. Always work with your healthcare provider to understand your symptoms and find the right plan for you. If you're over 50 or you're caring for your parents and you found this helpful, I invite you to subscribe to Senior Guide for more videos on blood flow, brain health, leg circulation, heart health, and senior wellness. Share this video with a friend or family member who might ignore these signs. Your brain and your legs carry you through every day of your life. Take care of the blood flow that supports them, and they can support you for many years to come. Stay curious, stay hopeful, and I'll see you in the next episode of Senior Guide. In this episode of Senior Guide, I'm going to walk you through 7 early warning signs that your brain and legs may not be getting the blood flow they need. These are signs many seniors brush off as just age, but sometimes they're your body's red flags. This video is not to scare you. It's to help you notice patterns earlier, so you can talk to your doctor, make changes, and protect your future health. Let's get started. Section 1. Quick explanation. Why blood flow matters before we talk about the 7 signs. Let's quickly understand what's happening. Your arteries are like flexible highways carrying oxygen-rich blood to your brain, heart, and legs. When you're young, those highways are smooth and wide. Over time, they can become stiffer, narrower, or partly blocked by plaque. When that happens, your brain may not get the oxygen it needs. You may notice slower thinking, fogginess, or memory slips. Your legs may not get enough blood, especially when you walk. You may notice pain, heaviness, or fatigue. The medical term for poor blood flow in the leg arteries is often peripheral artery disease, or PAD. Poor blood flow to the brain can increase the risk of strokes and vascular dementia. You cannot diagnose yourself from a video, but recognizing patterns and then talking to your doctor is one of the best gifts you can give your future self. Now, let's go through the 7 warning signs. Sign number 1. Leg pain when walking that improves with rest. Our first warning sign shows up in your legs. If you notice pain, cramping, or tightness in your calves, thighs, or buttocks that starts when you walk or climb stairs and goes away after a few minutes of rest, this can be a classic sign of reduced blood flow to your leg muscles. Think of it like this. Your leg muscles are the workers, and your arteries are the delivery trucks bringing oxygen. When you walk, the workers need more deliveries. If the roads are narrowed by plaque, the delivery trucks get stuck, and your muscles protest with pain. Many seniors call this walking cramp, or my legs get tired quickly. They stop, rest for a moment, and it feels better. That on and off pattern is a red flag you should not ignore. What to do? If this is happening to you regularly, know where the pain is and how far you can walk before it starts. Bring this information to your doctor. Simple tests like checking pulses in your feet or a Doppler ultrasound can help assess blood flow. Sign number 2, cold feet or toes compared to the rest of your body. Our second sign is also in the legs and feet. Do your feet or toes often feel colder than the rest of your body, cold even when the room is warm, different in temperature from one foot to the other? Everyone can get cold feet sometimes. But if one or both feet are consistently colder, especially compared to your hands or compared to earlier in your life, it may be a sign that less warm blood is reaching those tissues. Imagine turning down the water in a shower. The last place to feel the change is the far end. Your feet and toes are at the far end of your circulation. What to do? Gently touch both feet and compare temperature. Notice if the skin looks pale, bluish, or shiny. If one foot is much colder or looks very different from the other, talk to your doctor. This doesn't always mean a serious blockage, but it's worth checking, especially if you have diabetes, high blood pressure, or a history of smoking. Sign number 3, tingling, numbness, or pins and needles in hands or feet. The third sign is more about sensation. If you often feel tingling, numbness, pins and needles in your hands, fingers, feet, or toes, and it happens frequently or doesn't fully go away, blood flow may be one piece of the puzzle. Nerves are very sensitive to oxygen supply. When circulation isn't ideal, nerves can start complaining with strange sensations. There are many possible causes for tingling, such as diabetes, nerve compression, vitamin deficiencies, but poor circulation can make it worse. What to do? Pay attention to where the tingling happens and how often. Is it worse when you sit or stand for long periods? Mention it clearly to your doctor, especially if combined with other signs in this video. Sign number 4, feeling lightheaded or dizzy when standing up. Now, let's move up toward the brain. Have you ever been sitting or lying down, then stood up quickly and felt your vision dim, see stars, or feel like you might faint? An occasional brief moment can be normal, especially if you stand very fast. But if this is happening often, or you feel like you might fall, your body might be struggling to get blood up to your brain quickly enough when you change position. This can be due to dehydration, medications for blood pressure problems with the autonomic nervous system, or stiffer, less responsive arteries. Think of it like standing up and your brain saying, "Where's my blood? Hurry up." What to do? Mention this to your doctor, especially if you actually fall or nearly do. Rise from bed or chair slowly. Sit at the edge of the bed, move your feet, take a breath, then stand. Check your blood pressure sitting and standing if your doctor recommends it. This is not just about comfort. For seniors, dizziness on standing is a fall risk, and falls can be life-changing. Sign number 5, mental fog, slower thinking, or trouble focusing. Our fifth sign is quieter, but very important. If you notice, your thinking feels slower than before, you lose your train of thought more often, you find it harder to concentrate on conversations or reading, you feel mentally foggy. At times, some of this can be normal aging. But when blood flow to the brain is reduced, brain cells may not get the steady oxygen and nutrients they need for sharp performance. Remember, even at rest, your brain uses about 20% of the oxygen in your blood. When that flow is less efficient, the city of your brain may slow down. Important. This doesn't mean everyone with brain fog has a circulation problem. Sleep, stress, medications, mood, and many other factors matter. But if brain fog is new, worsening, or combined with other signs here, it's worth discussing with your doctor. Sign number 6, trouble with balance, shuffling walk, or frequent stumbles. Our sixth sign is one you might see in the mirror or feel in your daily walk. Have you noticed your steps getting smaller or more of a shuffling walk? You feel less steady turning or walking on uneven ground. You bump into furniture more or stumble more often. Balance is complicated. It involves your brain, your inner ears, your eyes, your muscles and joints, and the nerves in your feet and legs. Poor blood flow to the brain or legs can weaken any part of that team. If your brain isn't getting enough oxygen, or your leg muscles tire very quickly due to reduced circulation, your confident stride can turn into careful, hesitant steps. What to do? Don't just say, "I'm getting old." Tell your doctor you feel more unsteady or that your walk has changed. Ask whether a balance assessment, physical therapy, or circulation check is appropriate. Early attention can prevent falls and keep you independent longer. Sign number 7, Slow healing wounds or color changes in your lower legs and feet are last sign is one you can see. Take a look at your lower legs, ankles, and feet. Do you notice small cuts or sores that take a long time to heal? Areas of skin that look very pale, bluish, or dark and shiny? Hair loss on the lower legs you didn't have before? Skin that feels thin, tight, or fragile? When blood flow is reduced, your tissues don't receive enough oxygen and nutrients to repair themselves quickly. A tiny scratch might turn into a sore that just doesn't want to close. In more serious cases of poor circulation, ulcers can form, especially around the ankles or toes. This is especially dangerous if you also have diabetes. What to do? Inspect your feet regularly, top, bottom, and between toes. If you see non-healing sores, big color changes, or very shiny skin, contact your doctor or a foot specialist promptly. This is one sign you should never ignore. When TOs seek urgent help, most of the signs we've talked about develop slowly. But there are some emergency red flags you should know. Call emergency services or go to the hospital immediately if you notice sudden weakness or numbness on one side of the body, sudden trouble speaking or understanding words, sudden confusion, severe headache, or loss of vision, sudden, severe leg pain with a very cold, pale, or blue leg. These can be signs of a stroke or a sudden blockage in a major artery. Time is brain. Time is tissue. Don't wait. What you can do: general support, not medical advice. If you recognized yourself in some of these 7 signs, don't panic. Instead, think of this as your early warning system. Here are some steps to consider. With your doctor's guidance, talk openly with your healthcare provider. Don't minimize your symptoms. Mention specific patterns. When the pain starts, how far you can walk, how often you feel dizzy, or how your thinking has changed. Know your numbers. Ask about your blood pressure, cholesterol, blood sugar, and weight. These all affect artery health. Move in ways that are safe for you. Gentle walking, ankle circles, seated exercises, and leg strengthening, approved by your doctor, can help circulation over time. Supportive nutrition. In another Senior Guide episode, we talk about foods that support healthy arteries and blood flow. The small choices you make daily add up. Don't smoke. If you smoke, get help to quit. Smoking is one of the fastest ways to damage arteries. Remember, your arteries are living tissue. They respond to how you treat them over months and years. You cannot change the past, but you can influence your future. In this episode of Senior Guide, I'm going to walk you through 7 early warning signs that your brain and legs may not be getting the blood flow they need. These are signs many seniors brush off as just age, but sometimes they're your body's red flags. This video is not to scare you. It's to help you notice patterns earlier, so you can talk to your doctor, make changes, and protect your future health. Let's get started.